Welcome back to Las Vegas. Now, there's a local mother who wants to warn other parents about a rare COVID complications kids can endure. Thanks to Intermountain Healthcare, the sponsors of this segment, families facing this challenge have the care that they need. COVID-19 can turn a regular health condition into a rare one.
He is a bright young boy. He's very smart, athletic. He runs around all day, but as for right now, he can't, due to what happened to him with his COVID-19 turned into MISC.
With the help of Intermountain Healthcare, Sharella Ruffin, mother of 7-year-old Zaire, is on a mission to warn other families of this COVID complication.
MISC stands for Multisystem Inflammatory Syndrome in children associated with COVID-19.
Dr. Trong, a pediatric cardiologist, says MISC is something she has seen since the start of the pandemic and is one of the most extreme ways kids can be impacted by COVID.
Most common symptoms that we see are gastrointestinal symptoms. We also commonly see something called mucocutaneous changes, meaning a rash, red eyes. Sometimes kids can have swollen hands and feet as well. Things that gets kids in most trouble with MISC is that it can affect the heart. Namely, it can affect the squeeze of the heart. And then, as I mentioned, kids can present in shock.
Zaire was unusually weak and sleepy as well. After several doctors' opinions and still so much uncertainty, Sharella finally got answers.
So we called 911, and from 911 we went to UMC Hospital, and we never left from there. And that's when it all came out that he had COVID. It turned into MISC, and they can't determine when he had the COVID. They don't really know, but they know that he had it.
Because of the antibodies, right?
Yeah, the antibodies.
Zaire's condition became worse, but his family's hope became greater when introduced to Intermountain Primary Children's Hospital in Salt Lake City, Utah.
And I thank God that happened, because today he wouldn't be here.
Dr. Trong, who is with the Primary Children's Hospital, says Zaire's case was one of the most severe they've ever seen. And in order to save his life, he needed to be on an ECMO machine,
which is extracorporeal membrane oxygenation, meaning that his body was so sick that his heart was not squeezing well, and that sort of apparatus helps to maintain organ perfusion because he was so sick.
According to various studies, less than 4% of kids with MISC have actually needed the ECMO machine. So, in Zaire's case, he became a survivor and a legend.
He was the first kid that ever flew with an echo, Now they know that it works, and they can fly and save other kids' lives.
Not all children's hospitals have ECMOs. So with their team, their resources, and studies on MISC, the Intermountain Primary Children's Hospital is at the forefront of understanding, treating, and managing this condition.
The biggest thing with them is the love and support that they give people.
And as Sharella is accepting donations for Zaire's care and prays he can get back on the dance floor and the basketball court soon, she wants to leave other parents with this message about MISC.
A lot of people say, my kid was healthy, my kid was healthy. Your kid can be healthy, and it can still take over your kid's life. That's how strong it is.
Well, continued prayers for their family. Thank you to Intermountain Healthcare for sponsoring this segment. For more information, visit intermountainhealthcare.org/Nevada. We'll be right back.